Colorado weighs replacing Obama's health policy with universal coverage. Denver. For years, voters in this swing state have rejected tax increases and efforts to expand government. But now they are flirting with a radical transformation, whether to abandon President Obama's healthcare policy and instead create a new, taxpayer-financed public health system that guarantees coverage for everyone. The estimated $38 billion a year proposal, which will go before Colorado voters in November, will test whether people have an appetite for a new system that goes further than the Affordable Care Act. That question is also in play in the Democratic presidential primaries. The state-level effort, which supporters here call the Colorado Care Plan, would do away with deductibles. It would allow patients to choose doctors and specialists without distinguishing between those in-network and those out-of-network. It would largely be paid for with a tax increase on workers and businesses, and cover everyone in the state. Supporters say most people would end up saving money. Insurance groups, chambers of commerce and conservatives have already lined up in opposition. They say the plan's details are vague, its size and cost galling. The proposed health system would have a budget bigger than that of Colorado's entire state government. A new 10% tax on payroll and incomes to pay for the system would push Colorado's tax rates to some of the highest in the nation. The proposal's chance of success is dubious. Colorado has a mixed record when it comes to ballot measures, though it has passed some notable ones over the years, including marijuana legalization and the Taxpayer Bill of Rights, an anti-tax, anti-spending constitutional amendment. But the proposal had enough support to garner 100,000 signatures, which put it on the ballot. It has also worried insurers, and some in the medical community and the business community, enough for them to organize in opposition, even enlisting a Democratic former governor to help in their campaign. In this season of political discontent, the notion of dismantling the health insurance system has tapped an aquifer of frustration from voters. People say that even after the Affordable Care Act, they still pay too much in premiums, plus thousands in deductibles, and still have to worry about being bankrupted by a disabling car crash or an extended hospital stay. Continue reading the main story. Related coverage. Left-leaning economists question cost of Bernie Sanders's plans. February 15, 2016. First draft. Bernie Sanders releases details on health plan that would raise taxes but, he argues, save on costs. January 17, 2016. Public health. News about Obamacare has been bad lately. How bad? April 13, 2016. Surge in Medicare Advantage sign-ups confounds expectations. February 12, 2016. I think insurance is one of the biggest jokes and crooks, said Brandon Barta, 38, of Denver. He said his father, Dixon, who worked at a gas station, never received aggressive enough treatment for his prostate cancer. He died last May at the age of 64. He was overlooked, Mr. Barta said. Mr. Barta said he was intrigued by the idea of a universal health plan that covered maternity care, checkups, emergency room visits and hospital stays, all the way through end-of-life care. Like millions of Americans, he has health insurance tied to his work. His coverage lapsed recently when he switched jobs to start working for a golf entertainment complex, and he is still waiting for his new plan to kick in. Still, he has questions about how universal coverage would work and how much it would cost taxpayers like him. The answers: if a majority of voters say yes, the system would start running in 2019, and essentially be a startup health cooperative bigger than companies like Nike and American Express, according to the Colorado Health Institute, an independent policy group. A 21-person elected board would set the benefits and budgets. The system would be financed by payroll taxes of 3.3% for workers and 6.7% for employers. It would impose a 10% tax on investment income, people who are self-employed and some small business income. In the contest for the Democratic presidential nomination, Hillary Clinton, echoing many moderate Democratic leaders here, has said that she wants to keep and improve the Affordable Care Act, Mr. Obama's signature legislative legacy. But her opponent, Senator Bernie Sanders, who won Colorado's Democratic caucuses last month by nearly 20 points, has advocated abandoning the health law for a Medicare for All approach. His proposal is similar to the Colorado Care Plan. The campaign over the Colorado initiative has had the unusual effect of putting conservative critics in the position of defending Mr. Obama's health plan against an assault from the left. At the same time, it is energizing progressives, who say the Affordable Care Act was a giveaway to the insurance industry that, even with an estimated 20 million people newly insured, has left too many others without coverage.